what are some things that you can do to help your progress with breastfeeding. Hi, my name is Noreen Carver. I'm one of the lactation consultants here at Tucson Medical Center. Today we're going to talk about those first few days of breastfeeding when you're in the hospital and what kind of things you might expect and what are some things that you can do to help your progress with breastfeeding. So first thing I'm going to discuss is skin to skin with your baby, and that's a great thing to be doing in these first couple days especially, but actually going on further, it's a great way to calm your baby if your baby's upset, even into their first and second month. So skin to skin is just basically you lie your baby on your chest, their chest is naked, your chest is naked, you can put a blanket over them if you like, and you just be with them in skin to skin like that. Skin to skin does a few things for baby and a few things for you. One of the things it does for baby is regulate their blood sugar. So especially for babies that might be having some difficulty with blood sugar, skin to skin is the best place for them to be. Secondly, it regulates their temperature and helps them recover from the birth process. For you, one thing that's great about skin to skin is that it helps to increase your milk production, because when you're skin to skin with your baby, you produce oxytocin as your baby produces oxytocin too. And that oxytocin increases milk production. The next thing that would be really beneficial to do in the hospital in those first few days is something called hand expression. And hand expression is a specific technique to make sure that you can get milk out of the breast. It can help you because it increases your milk production when you stimulate your breasts with hand expression. You can also finger feed your baby. So if you have a sleepy baby in their first few hours after birth or the first day, you can be finger feeding your baby with your hand expressed breast milk. Some studies show that hand expressed breast milk has more fat content in it than if you were to pump it. So we really like to teach you hand expression these first few days and help you with that process. It helps later on too to see how much milk you're making. And the third thing that I want to talk about is nipple soreness. So that's something that can occur in these first few days, and we try to prevent it by teaching you how to latch your baby deeply. By that, I mean not just on the nipple, but you want to make sure that baby's mouth is over the areola as deeply on the breast as possible. If you have a deep latch, it's usually pretty comfortable. You might have a little bit of tenderness, but for the most part, you're pretty comfortable. If you're having difficulty and nipple soreness, call your nurse in and ask that person to come in and help you achieve a deep latch. You can also request a lactation consultant, and we can come in and help you as well.